Good afternoon, everyone. My name is Kelly Jones, and I am a health educator senior with Cook County Health Department, and I am your facilitator and host for the CCDPH School Health Meeting. Welcome. Thank you for taking the time out of your busy schedule to join our meeting. I know everyone is eager to find out information on what they can do to protect themselves or their students from the measles occurrence that's happening. So we're going to get started. Our meeting objective is to share updates, information, and resources to help schools navigate school health issues, answer any frequently asked questions, provide CCDPH contact information and resources. All of our webinars are being recorded and they are uploaded to our website as well as our CCDPH YouTube page. For those people who are currently working and aren't able to watch it live, you can go back and watch it on demand at your leisure. Little housekeeping, please keep your lines muted. Feel free to put any questions in the chat. We will have a robust Q&A session, I'm sure. And our agenda today, trying to bring in a little of that spring sunshine, we're going to have a measles update by our communicable disease department. We're going to talk about immunization data, update, routine vaccination resources. If we have a chance, depending on the length of our conversation regarding measles and communicable diseases, we will have an update on the naloxone standing order issue that has just been happening. As you know, schools are able to request naloxone standing orders from the local health department as of January of this year. And Denise Holman will be on if we have the time to discuss it. If not, then we will make sure we get that information out at a later date. I'm going to stop sharing and I will welcome Sheila Giovanni, who is going to speak to you about the communicable disease update. Welcome, Sheila. Can you hear me, Sheila? Maybe she's having some sound issues. We'll give it another second.
Hi, Kelly. This is Sheila. Can you hear me now?
I can hear you now. You're good to go.
Sorry about that. Thank you.
No
So I
problem.
am now presenting my screen. Can you see it?
Not yet.
Okay.
Maybe come out and come back in.
Sure thing. I'm going to hit present yet again. Let me know if you can see it.
Did you hit share?
Yes.
No, I don't see it. It's not coming up. Would you like me to share your slides if you're having some issues?
Yes. Do you mind?
No problem. And they are taking their sweet time coming. It says still working on it, so give it a minute. There it goes. Can you see that
Okay. Thank
okay?
you. Yeah, I
Okay.
can see it. Can you put
Okay.
it in presenter mode for me? Okay, well, I'll go ahead and get started. So, thank you and good afternoon. I really appreciate that warm introduction, Kelly. So, today I want to provide a overview for measles, including school vaccination information, guidance and response, and communication updates. There has been a lot of news surrounding measles lately, and we really are eager to discuss the topic. But before we begin, I would like to inform you that as of today, March the 15th, 2024, timestamp 205, that there is no confirmed cases of measles in suburban Cook County. It is essential to note that timestamp because circumstances do change relatively quickly and daily. But we have been investigating contacts of exposures in suburban Cook County as it relates to Chicago measles outbreak. Next slide, please. Thank you. So today, overview will cover measles, measles response. We'll provide some information on school guidance and again, touch upon the communication resources. And then we're going to close with our story for Cook County Department of Public Health, October to November measles outbreak. Next slide, please. Thank you. So, measles is an airborne disease that spreads easily through the air when an affected person coughs and sneezes. It is highly contagious and it can be transmitted through breathing, coughing, and sneezing, making this a serious public health concern. Next slide, please. Not to get really clinical here, but I do want to note that symptoms normally begin about 10 days after exposure. We have our prodromal symptoms of measles that can consist of a fever up to 104. We have cough, coryza, conjunctivitis, and these normally last about 4 days. And we have our couplet spots, which is the rash that is unique to measles. So it normally develops around the same time. And it is important to note that a person is considered contagious 4 days before the onset of the rash and then 4 days after. Next slide, please. And it is important to note that if you are seeing anything of a suspected or, of course, a confirmed measles cases, it should be reported to the local health department immediately. So, as mentioned earlier, measles is an airborne disease that is spread through particles that can remain suspended in the air. These particles can linger in the air for up to 2 hours after an affected person has left. So, according to this illustration here, one confirmed person with measles can potentially infect up to 18 others. That's why it's such a significant public health concern. Next slide, please. Thank you. So I want to take a moment to talk about the criteria for exclusions from schools. So I want to definitely point out that there is no need to quarantine if you are vaccinated. But if you are not vaccinated or do not have natural immunity for measles, you are considered a susceptible person. And a susceptible person is defined by any person that does not have evidence of one, documentation of 2 doses of measles vaccination. Two, a physician statement indicating the date when the person had measles disease. Three, a laboratory evidence of measles immunity. So, with that being stated, it's important to note that a susceptible person to measles must be excluded for 21 days until we are able to verify their immunity. And if they do not have immunity, they have to be excluded 21 days after the onset of the last case. I have provided the IDPH administrative code here and this link provided for you so that you can find out more information about the criteria for exclusion from schools as it relates to measles. Next slide, please. So there is some good news. I'm so happy to share that measles is preventable through vaccinations. Vaccinations are widely recognized, they're long-standing, and it's a safe and effective preventive measure against measles. With measles on the rise in our surrounding areas, I encourage you, our school nurses and staffs, to take a moment to review the students' medical records and then identify those unvaccinated students. And then I urge you to get them vaccinated for measles if they do not have a medical or religion exemption. It is important to note that the Illinois law requires that students have proof of vaccination or an exemption. 1 dose of MMR is 93% effective, and 2 doses of MMR is 97% effective. So please, again, take a moment to look at your students' records and all of the students that are not vaccinated and do not have does not have exemption, please work with getting them vaccinated. Next slide, please, Kelly. So we're going to take a moment to shift gears here and talk a little bit about our communication updates. So the Cook County Department of Public Health team has graciously provided some useful resources that can help easily shared with family, friends, members, school communities, and close friends. These resources have been carefully curated to help educate and inform the public about measles prevention. So please don't hesitate to utilize these valuable resources and share knowledge amongst your loved ones and peers. Next slide, please. So here are the newly created fact sheets for measles. Don't they look nice? I think they do. They are available in English and Spanish, and there will be more languages available in Polish and simplified Chinese within the next week. Please feel free to click on these embedded links inside this document and share widely. Really great resources. Next slide, please. So this has this very cool red header on it called Red Alert Bar, and it houses our Cook County Department of Public Health website. It is worth checking out. It offers some really nice information through press release and media interviews to learn about measles and what's happening in our surrounding communities. Again, in this document, there are embedded links, so you can just click right on in there and it'll take you to our Cook County Department of Public Health website. Next slide, please. So we can't forget our social media platforms that provide CCH graphics and information to get you thinking about measles. Get it? Think measles, which is available in multiple languages. There are valuable resources that you can share with the community to help to help promote vaccines within your schools and your communities. It's called Think Measles, Get Vaccinated. Next slide, please. So, I would like to end my presentation by telling you a story. On October the 10th, 2023, Cook County Department of Public Health was notified by a suburban Cook County hospital of a suspected case of measles of a 2-year-old unvaccinated child. PCR tests confirmed positive on October the 11th for measles, and then our investigation began. We notified people about exposures. We provided education. We set up monitoring. To many, we worked really hard to get immunoglobulins and vaccinations to those at those appropriate times. And we really needed to make sure that we were verifying proof of immunity to measles and quarantine those whose statuses were unknown. We could not have done it without your help, our schools. You guys were so amazing and awesome in taking our calls, getting back to us in a timely manner, providing us with those vaccination records that we needed. And because of your efforts, we were able to return families, students, and parents back to work and school in a timely manner. So, I really do just want to take a moment to thank you. Again, we could not have done it without you in helping us to verify those attendees from your schools. And because of that, we had 5 confirmed measles cases. And these cases all shared apartment building, and there were 2 exposed confirmed cases that were household linked. And then there were 2 other children who were unvaccinated that shared that common area that contracted measles. But we had over 600 contacts exposed, healthcare workers, companions, individuals within the hospitals were exposed, and we had no new cases of measles um, at all. So I really just want to take a moment to thank you very much because it means a great deal to us. We will be calling on you in the future. And as always, cases are on the rise with measles. It is important to remember that vaccination is the key. Thank you.
That was such great information, Sheila. We really appreciate the time you took into putting together that presentation. If you have any questions for Sheila regarding any guidance or any questions regarding measles, please put them in the chat. We are here to answer those questions. There is one question in the chat I'll read to you, and we can continue on if there are no further questions. What are the chances of Illinois not allowing religious exemptions for school vaccinations and only allowing medical exemptions?
I think that chance is very unlikely. When it comes to religious exemptions, those are a little bit more personal, and we have to uphold that. And if students have religious exemptions, we have to follow that guidelines to make sure um, that we are doing our due diligence to educate them about the importance of getting those vaccinations, but also understanding their right from that religious aspect to not do so.
Great. We have another question. What is considered a close contact? Would it be the unvaccinated in the class or the school? What about staff members' vaccination status?
So that is a great question. So a close contact is any person that shared the same space with, well, it's two. So it's any person that shared the same space with a confirmed case of measles, or 2 hours after that person left, they are considered exposed. And that can be also companions that were there, healthcare workers, other individuals within that setting. But if you are vaccinated from with measles MMR vaccination, 2 doses, you are 97% effective against the, the disease. So therefore, you're considered immune. When we're looking at close contacts, those are those individuals that we spend most time on are those that are unvaccinated or looking to improve their immunity to measles.
Thanks, Sheila. There are no more questions in the chat, but you can continue to put questions in the chat, and at a later time, we'll address those questions. I'm going to stop sharing, and then we will move on to one more question. We can get to this question while we introduce the next presenter. If unimmunized and they get the vaccine within 72, I'm assuming that means hours
72 hours.
exposure, how how soon can they return to school?
If Dr. Rubin or Damien is on, I would like to pivot that question to them because I'm not really sure about that specific guideline if they get it within 72 hours. I think there's still some period that they can be exposed, but if one of them are on here, I would like to pivot it to them.
Sure. Dr. Rubin, would you like to take that?
Sure. If they get a vaccine within 72 hours, then the hope is that they will be prevented from getting measles. However, it's not like the same level of immunity. It takes a while for your body to build up immunity. So I think that they probably still would have to be quarantining, not isolating, but quarantining for 21 days, which means they can't leave their home for 21 days. So the idea is to make sure you're vaccinated up front, and then you don't have to worry about that.
That's a great tip. Thank you so much for that information. We will go on to and introduce Kelly Bemis, who is going to talk to you all about immunization data and a robust thank you for all of your hard work. Kelly, if you are on, you can share your screen. Kelly, are you on? If not, we can pivot Kelly. Oh, I think I hear
Can you
something.
guys hear me now?
Yeah, I can hear you.
Yeah, sorry about that. Just had to double unmute. I just wanted to build on what Dr. Rubin said there as well. So just so everyone's clear, there's two different kinds of post-exposure prophylaxis when someone is exposed to measles who is susceptible or not vaccinated. They can either get immune globulin within 6 days. If that happens, those people do still need to quarantine. As Dr. Rubin said, they would need to actually stay home for 28 days. However, if you are able to get a dose of MMR within 72 hours after the exposure, those children are allowed to return to school and work. So hopefully that
Yeah.
answers that question.
Yeah, thanks so much, Kelly. I got it reversed in my mind between the immune globulin and the vaccine. So yeah, so if you do get that vaccine right away, then you're okay to go back to school. But if you get the immune globulin, you have to be out for actually a full 28 days.
Kelly, before
And
you
I
begin
did,
for you and Dr. Rubin, there's one more question I think would be best pivoted for one of you. Should adults that were vaccinated as children have titers drawn to see if they need to be vaccinated again?
No.
if they're exposed, yeah, sorry, go
Go
ahead,
ahead,
Dr. Rubin.
Kelly. No, go ahead. It's okay.
If they're exposed to measles, as long as they have documentation, so they know for sure they actually have their vaccination card from childhood, or if they had it recently, they would not need to get a titer drawn. So we do, there is that 3%, as Sheila said, there will be a very small proportion of people that don't respond to the vaccine, but generally, if you've been vaccinated, there shouldn't be a need for a titer to be drawn. If you're not sure, that's typically when we would recommend that someone get a titer, just so that we can be absolutely positive that that person was vaccinated.
Sounds great. There are no
Any
more
other
questions. No, you can proceed. Thanks.
Great. And I did start sharing my screen, so I just want to confirm that everybody is seeing the ISB health requirements page.
Yes.
Okay. So I imagine that probably most of the school nurses here on the call are familiar with this page, but just if not, all of that hard work that you guys do at the beginning of every school year to collect vaccination records and submit them to ISB, later in the year, ISB actually takes all of that data and makes it publicly available. So this is what it looks like on their website. If you opened any of these Excel spreadsheets, it would have the name of your school, how many children attend, how many are in compliance with submitting their school health forms, and then how many are vaccinated versus seeking exemptions. So we just wanted to let you guys know kind of what we actually do with all of that data that I know you all work so hard to collect every year. We do on our end also put that to use. I'm sure you guys are using it as well. We had built this application, and I will drop this URL in the chat. So if you guys are curious to go and look at this in the future, this dashboard takes that data for suburban Cook schools that's public on ISB's website and just turns it into something that is at least a little bit easier for us to kind of see trends at a larger level if we kind of zoom out. We have a landing page here that goes into detail just about the kind of data that's in this application in case it does get used by members of the public. And then on the next tab here, we've aggregated all of that data to see on a larger level, what trends are we actually observing here in suburban Cook County. So you can see that across our jurisdiction over the past, I believe it's 9 years of data that we have in here, there is this steady trend down for all of the major childhood immunizations. We had this big drop in the pandemic year that was more likely due to just the difficulties of everything in the pandemic year. But if you almost kind of take that data point out of the line, you can see it's this steady line down. So we still have high coverage overall throughout the jurisdiction. We're encouraged about that, but this is obviously a very worrying trend that we're invested in trying to reverse. You can observe what these trends look like broken out by public schools versus private schools. And then further down, for those students who are not protected, you can see what are those actual numbers on the jurisdiction level. So this is measles here. So for measles, we had this past year in suburban Cook County, 97.29% coverage. That sounds really high. That sounds great. But keep in mind that what that means is still 10,702 children that are not protected against measles spread out throughout the jurisdiction. That is quite a lot. We can also see ISB now censors those files for small counts. So that makes it a little bit harder for us to see exactly what kinds of exemptions are being filed. But prior to the 2019 school year, they did not. So just kind of looking at that particular time period, you can see that the largest chunk here are religious exemptions, and that those exemptions, I'm just going to zoom in on them here, were increasing over time. So like I said, we've lost visibility into that granular data over the more recent years, but national survey data for both our area and the country as a whole shows that this trend is generally continuing, that exemptions are on the rise and the specific types of exemptions are religious exemptions. Also in this application, you can actually look and see for each school kind of how we're doing. Are there any clusters of schools that have lower rates together? Those are things that we look at as kind of a potential area where if we were to have a case, we would need to be ready to jump into action. And then we have this tool over here of Find My School or District. This is really more geared towards members of the public, but you might find it interesting as well, because in addition to looking at a school, and we'll just pick one at random here. So you can see kind of how is my school stacking up over the rest of suburban Cook County, and then how are we stacking up against what we would consider based on literature, what we call the critical vaccination threshold. So this is really where we want to see every school ahead. So you can plot for your one specific school over time, again, kind of comparing to suburban Cook County overall, and then this green line is kind of where do we want schools to be. So we just wanted to make you aware that this tool is available, and again, as a chance to just say thank you for collecting all of this data and letting you know that we do put it to good use. So like I said, I'll drop this URL in the chat, and then if there's any questions, I'm happy to take questions.
Thanks, Kelly. That is a really interesting tool. I was in awe of all of that information, and you read my mind. I was going to ask you to put the link in the chat. I'm sure everyone is interested in that link, and then I will also make sure I share that links from now on so that everyone will have access to it. Thank you so much, Kelly. Before we go on to our next presentation, in keeping with immunization and drops in rates, we know that there have been a drop in vaccination compliance with schools, especially since COVID. So in order to get a better understanding of why that's happening, we've prepared a survey, and Neela is going to put the survey in the chat and talk about it just for a second. And so we can collect that data and get some ideas on how we can respond as a health department to assisting with the community with increasing those vaccination rates. Neela, did you want to hop on real fast?
Sure. Hi, everyone. My name is Neela Satyanarayana, and I help with some school health meeting things along with our tobacco prevention and control program. I put the link in the chat. There's just two quick questions, but if you're on a different platform or easier, you can also just scan the QR code that hopefully you can see on the screen and answer the questions. So there's two questions. What reasons have parents, guardians given for not vaccinating their children? Please select all that apply. There's 6 or 7 options there. And if you're looking at your screen, you can actually see the answers coming in, which is great. And then the second question is, what reasons have parents given most often for not vaccinating their children? And we want to know the most often reason, so just select one there. And this is to help us strategize, on next steps and information that we can utilize when planning further. So this will stay open throughout the rest of the meeting, but we'll also share it. Kelly will share it when she shares out the link to the recording and the slides and the other resource information so that people can continue to answer the questions even after this meeting is done, and we'll keep it open for a little while after that. So appreciate it. Thank you. 17 responses in. For the first question, it looks like vaccine safety, medical exemptions, and overwhelmingly religious beliefs as the top 3 so far. And then the top one most often by a landslide, religious beliefs, and it's confirmed, I think what we're hearing um, from you all and what we're seeing, in the data. So this is great. Thank you all so much. And again, that link for these questions is in the chat, and please continue to answer them. Appreciate it. And I'll stop sharing so we can move on. But again, we'd love to hear about what else you guys are seeing and hearing about
Thank you.
the vaccine hesitancy. Yep.
Thanks, Neela, so much. You guys
Yep.
are quick on the draw. We appreciate your participation. We will keep this survey open for at least a week for those people who watch this on demand and aren't able to react and participate right away. So we'll keep that open again, so we can take this data and see how we can best support the community based on these responses. And we'd like to welcome our illustrious partners at the Illinois chapter of the American Academy of Pediatrics, better known as ICAP. And they have some information on routine vaccination resources for you. Welcome, ladies.
Hello, good afternoon. All right. Awesome. So we will keep this brief for this afternoon, but thank you so much, everyone, for being here this afternoon. I know it's a beautiful Friday. And so we're just here again to talk about the school immunization resources that we have for suburban Cook County schools. And we're going to jump right on in. So some of you may remember some of this material that went out last year. Last year, we did a survey for school health staff for selected areas in the state, which one was Southern District of Cook County, to help identify how we, as the Illinois chapter of the American Academy of Pediatrics, or ICAP, can better support communication around those routine and school required vaccines for parents and guardians. So these were the main themes that came up from that school health survey last year for the Southern Suburban Cook County region. So themes that we're already seeing that we just discussed with our last speaker. So access to care is one, and we have specifics there, parent education with more of those specifics, as well as those rise of religious exemptions. And we have developed a series of posters and parent handouts, as well as social media materials with tailored messaging to help amplify some of that vaccination outreach and some of those initiatives that we are doing throughout the state of Illinois. So our first set of handouts is called the Healthy Kids Achieve More. So these handouts are and as well as corresponding posters, share key benefits of being healthy, like healthy attitudes, better sleep, higher self-esteem, improving concentration, physical performance, social emotional learning. And these materials link that to required vaccinations and how to improve your overall health. And building that narrative that getting school mandated vaccines is a major component of staying healthy throughout the whole school year, as well as having a successful school year. And then our next campaign here is the Safe Schools handouts that we have. And this is a parent handout, as well as some posters and social media posts that we have to educate students on the importance of school safety. So this intentionally pairs the damaging effects of preventable diseases with others like bullying and fighting that we sometimes see in our schools. And these materials define how long a student may be out of school because of these vaccine preventable diseases. And it shares that it's not just school that they'd be missing, but it could be really fun things that a lot of our students like to look forward to, like field trips, or even things outside of school, like sporting events and social opportunities. And then we also made a set of, again, parent handouts, posters, and social media posts for helping students and their families getting back on track on some of those routine vaccines that we saw slip during COVID, and as we are starting to come out of the pandemic, catching up with those doctor's appointments. And this really, again, links why health is really important for overall development and performance. And it, again, links a lot of being healthy and the shared benefits to things like higher self-esteem, having more energy, that social emotional learning component again. And these materials really try to link that and build that narrative of getting those school vaccines and the mandated vaccines contributing to a really healthy and happy school year. And then we also have our posting guide and social media graphics to share messaging about the real costs of getting sick, including missing school, or if students are involved in any after school activities like sports and missing things like practices or performances. And then also how that can really impact a family as a whole. So missing work, especially if it's a job that they might not have paid time off, things of that nature. So with these positive visuals, we hope that this social media campaign helps build trust and confidence with a parent or guardian's role in the vaccination process. And then we also have a set of social media posts regarding vaccine safety. During the COVID pandemic, we experienced greater scrutiny on these different vaccines in the vaccine development process. And there was just widespread misinformation throughout the social media channels. So we created these graphics and corresponding posts that can be shared throughout any social media network to help drive a more positive narrative around vaccine safety.
Perfect. Thank you so much, Brandy. And we will put in the chat a link on our Illinois American Academy of Pediatrics website where all this information is downloadable, the social media images, the posters that can be used in schools as well. So moving on, similar to last year, ICAP will be embarking on another school health survey in these selected counties, and we will also be we're also recruiting for a work group and to help with these similar initiatives of using the school health survey findings and data to inform educational materials and media messaging, and using our work group that is created to help address the barriers to vaccinate in these selected regions across the state of Illinois. So we would love, I will add it into the chat right now, but we'd love for those who in these selected counties, if you serve in them, to please fill out the survey. And if you're interested in the work group application, there will be a stipend of $1,000. We'll have monthly meetings to help address barriers and challenges to vaccination uptakes amongst pediatric and adolescent populations. There were those of you that were a part of it last year, I know really enjoyed it, and we'd really appreciate all those who do serve in these specific regions to answer the survey. And if you're interested in the work group application, that would be great as well. Both will be open for about 2 weeks. So we'd really appreciate any traffic and traction towards that. And if you're able to share out to those that you think might be appropriate, and this would be a good opportunity for, that would be great as well. And then lastly, on the note of measles, one thing I wanted to share as well. One, I will show you on our immunizations page on our Illinois website, we do have an area just for measles vaccination resources. With everything going on, we wanted to have encapsulate just one place that providers and clinicians can go to just get information on the latest information on measles. And we also have school immunization resources over here, the ones that Brandy walked through, where you're able to download different campaign materials, all the themes that Brandy touched on. And lastly, next week we will be having some measles webinars. So please stay up to date on our website, illinoisaap.org/events, and you'll be able to register and get specifics on those if you're interested in just keeping up to date on the measles outbreak. Thank you so much.
Thank you guys so much. Great information, beautiful graphics. Purple's my favorite color, so I love your website. If you are able to share your slides with me, I'll make sure they get out to everyone so they can have all that information. And we appreciate your partnership and your continued partnership. Thank you so much for that information. If there are any questions for them or anyone else, you can feel free to continue using that chat. I don't see any new questions yet, but I'll make sure I shout them anyone's way if we get any new questions. Thank you guys so much. So it looks like we do have time, barring I don't see any new questions, that we can get Denise on and she can give us an update on the naloxone standing order program. Are you on, Denise? I believe I saw her on earlier. She may have had to hop off. So we'll wait just another second. And if Denise,
I'm on.
oh, you're on. Okay, great,
Yeah, for
Denise.
some reason it would not let me unmute. Okay.
Teams is tricky.
Yeah. Give me
Welcome.
one quick second to make sure I can pull up my slide.
If not, I have it downloaded for you.
Uh, yeah, if you could pull it up
Sure thing.
or
Let's see how long it'll oh, it went quickly. There you go. Can you see that okay?
yep.
Okay.
All right. So if you could go to the next slide, Kelly. All right. So one of the things that we have noticed in suburban Cook County, or I should say in the county in general, is that overdoses have been on the rise in the last few years. As you can see, there's been a steady increase. And you might look at 2023 and think, oh, those numbers went down significantly, but we're still waiting for the medical examiner's office to go through all the cases from last year. So they're projecting that 2020 and 2023 will have about the same amount of overdose deaths. Next slide, please. And then we look at some of the data across the US, we see that there's been a reported a little over 107,000 drug overdose deaths in 2022, and it is projected to have a little over 110,000 for 2023. If we look back into data in Cook County, more than 90% of those overdose deaths include fentanyl. 70% of those deaths occur in Chicago. And unfortunately, one of the youngest deaths that we had in 2023 was an 8-month-old boy, and the oldest was 93. Next slide. What Cook County Department of Public Health is doing to respond to overdoses is that we have four major components of that. So we are doing trainings of opioid overdoses, naloxone use for community-based organizations and law enforcement agencies. So schools do count as community-based organizations. We distribute naloxone drug testing strips to community-based organizations and law enforcement agencies. Provide technical assistance for establishing drug checking and deflection protocols and programs, and also data collection on opioid use. Next slide. And one of the reasons that I'm coming to talk to you guys today is because there was a House bill that was introduced back in July of 2023. And the bill requires that kindergarten through eighth grade schools are to keep naloxone on site to prevent overdoses. And that went into effect January 1st. So every school is required by then to have it. So what the health department is doing to help out with that is that we are training staff on overdose prevention and naloxone use, as well as distributing naloxone to the schools. Next slide. And we did not issue this, so it came from the Illinois Department of Public Health last month, the standing order for naloxone. And I will also drop into the chat the link for you to grab that standing protocol. But one of the key factors that they put in this year for the standing order is that it puts schools as an entity that's supposed to have it. Also, it gave it gave approval for other sorry, I cannot pronounce the name, but it starts with an N. But it gave that is also approval for opioid overdose to be used if you have that on site. So next slide. And for naloxone use and reporting, there's two ways in which we encourage schools who receive naloxone from us to report. It's one, for anyone who's picked up from us, you will receive a email monthly via Airtable, just asking if there was ever a case where you had to use naloxone on site. If so, it's 3 to 5 questions of simply asking what happened. So for those schools, like I said, you'll receive that email monthly. And then also, if you had to use naloxone on site, you have to report to ISB the use, and the link is right there, which you can click on. And that again is a short form, as I have a picture on the slide that shows there's about 5 questions about the use. Thank you very much. Also, thank you, Kelly, for squeezing me in today to talk about it. Here's the that's my email address in which you can send an email if you have any questions. And then also for schools who are still in need of naloxone and want to receive from Cook County Department of Public Health, the link is here to put in that request. And I can answer any questions anyone has.
Great. I know there are plenty of questions regarding this program, and we can open the floor to questions while I am pulling up the resource slide. I know I've gotten lots of questions about the program, so I'm sure there are lots of questions to be had. There are a couple questions coming into the chat, Denise.
So you do not need training yearly. So if you want a refresher, we also have on our webpage, there's a video of this girl. She kind of sounds like me, and she's doing a quick presentation. It's about 13 minutes. If that's the way that you want to like stay abreast on your training or have it where more people in your organization can like have the training as well.
There's
For
another question. Oh, okay, go ahead. You saw
Okay.
it.
Yeah. For expiring naloxone, you can't just throw it in the trash. There's no special disposal that's needed. But also, if you want to, there are pharmacy take back programs, such as like if you go to certain police stations, there's also certain recycle stations that will take it, but you can also throw it in the trash.
Thanks for that. So please feel free to continue put any questions in the chat. Thank you, Denise, for taking the time and giving out that information. I know they've been waiting with bated breath for that, so I'm glad you were able to get that to them. And we can just go over some quick announcements and review some of the information that we have gotten. I just want to thank the people who saw the request for joining the School Health Advisory Committee, and we got a couple of members that joined. So I just wanted to say thank you for that. We appreciate your partnership, and we will continue to work together to make the school engagement better and respond to your needs. For contact information for CCDPH, for general questions, you can email our healthy cook at cookcountyhhs.org. If you'd like to reach communicable disease for line lists, reporting communicable disease metrics questions, you can email there ccdph_schools at cookcountyhhs.org. Our Cook County website is listed, as well as our Cook County specific website, school specific website, and our COVID-19 vaccine information website. Here is information on our Cook County health clinics, as well as our Stroger Hospital. We do not turn anyone away for inability to pay. So you can be seen at any of these clinics. You can call the number to get an appointment. You can see what location best fits you. And listed above on the first slide are just a few of the illnesses and ailments that you can come in and be seen for. As we stated by previous presenters, there are a couple measles webinars coming up next week. The first one is sponsored by Chicago Department of Public Health and IDPH. That is Wednesday for measles for clinicians. And there is one on the next day that is sponsored by IDPH for schools. I'm sure more people from this webinar will go to that one, but feel free to sign up for any of those webinars that you would like to get that information from. Here is information on Cook County Health Department in partnership with the Illinois Public Health Institute have produced several professional development trainings. There are computer trainings. I think there's one next week and one a few weeks away. I know a few school nurses have told us that they could use some assistance with improving their computer skills. So here's some computer classes. If you can't go, maybe tag team with a partner, one go and the other one teach you what they learned and to help each other out. Information for EpiPen and albuterol. I am the contact for the EpiPen and the albuterol program for Cook County Health Department. You can request a standing order and a prescription from Cook County Health Department for either EpiPen and albuterol, and our Dr. Joshi will sign that, and it's good for 1 year. For those who've been using the program for some years, there is a new document that must follow your request. You must also fill out a training document. At least 2 employees from your organization must be trained either by a school nurse or have taken some outside training classes to ensure that they know how to administer medications, and they must be listed on the form, and that must be sent out and turned in before we can process your request. And here is some information on some trainings. People have asked me about trainings. And here's some information on some trainings and resources on how to secure the EpiPens. There are some schools that are automatically opted into the Rescue Illinois program, and they've asked me how they receive this medication that they didn't request. There are some schools based on demographics who are automatically opted into the Rescue Illinois program. If you find yourself getting this information unsolicited, you are automatically enrolled, and you can contact Naomi Soto with any questions. If not enrolled, you can still receive those standing orders and prescriptions from Cook County Health Department. There's just some resources here on asthma education programs, as well as information on Denise, as she shared her information earlier for those naloxone requests. And I am just reiterating the information from our communicable disease department regarding the measles fact sheets. I slid them into our slide deck. Information on our general Boost Up campaign. And that's not only boosting up for your COVID vaccine, just staying up to date on all of your vaccines. And there's resources on our website to assist with that. And we still have information on how you can receive your COVID test at home. You can still go to covidtest.gov and receive 4 at-home tests to be mailed to you, as well as you can request some COVID antigen tests from Cook County Health Department directly. The link is in the slide, as well as some PPE. And here's information on mobile vaccine resources from certain schools who said they would like to have more information on how they can bring these services to their school directly. I've put all these information on one slide with their contact information linked in, and you can utilize those mobile vaccine resources, as well as IDPH has a Wellness on Wheels vaccine request form. There are a few additional resources that we'd like you to be able to utilize, as well as some mental health resources with our partners with NAMI Chicago. They have some support groups, as well as the 988 Suicide and Crisis Lifeline, as well as 211. If you haven't heard of it, it's similar to 311 and 411, except it is a nationwide resource that you can call, text, or go onto their website and ask for things such as housing information, food pantries, and anything else you can think of as a social service. information on mental health and outreach to homeless for our partners at Sertoma, as well as a resource from the Forest Preserve for free transportation to Forest Preserve events for your school or your organization, and also some information on CPR. And then the links all on one page to the COVID-19, the shiny dashboard that Kelly Bemis talked about earlier, finding vaccine locations, as well as to receive those in-home tests and rapid antigen tests. And I can't believe we kept this under 3 o'clock. There are a few questions that we want to go over in the chat, but we made really good time. And I'm so glad you guys are here. Let me go back up and review some of these questions we missed. Medications cannot be discarded in the trash. They need to be disposed of properly with medication disposals. You are correct. There are some medication disposals that law enforcement have, as well as a local pharmacy, CVS, Walgreens has sort of like their mailboxes that are there at the pharmacy that you can put those medications into, as well as there's usually some certain villages have a give back program. So look out for those resources. Are there any other resources at CCDPH for immunizations of measles? If Dr. Rubin is still on, if she's aware of any resources that, other than going to ACHN clinics, please share, because I'm not certain. I don't know if Dr. Rubin had to hop off. So just to answer your question, we do not have a large scale measles vaccination event like you may find when we were doing COVID or maybe some flu shots. But if the person is uninsured, they can go to our ACHN clinic that we listed in previous slides, and then they could get any medical attention that they may need. And someone said most medication take back bins in the community do not accept needles. So that will require a little bit of research, and we will make sure that we find those resources and come back and be able to share that. Are there any other questions regarding measles or for any of our presenters that we'd like to share with you all? If not, I am very happy that you guys all took the time out of your schedule to join us to get this information. I hope that this information was helpful and you can take it to use it within your community and with your schools. And we have one more comment. The North Riverside Police Department accepts needles. That is a great resource. Thank you so much, Julie. If there is nothing else, happy Friday, happy Ramadan, happy Easter, happy St. Patrick's Day, and enjoy the rest of your day. Thank you for taking the time out of your day, and thank you for your partnership. Be well and have a great weekend.